Welcome to the Partners in Health Tools You Can Use. I'm Rain Vandenberg from the University of Alaska Anchorage's Center for Human Development and LEND program. This training will focus on the important role caregivers and direct service providers play in supporting the health of people with intellectual and developmental disabilities, or IDD. Where are we headed today? By the end of this training, you will be able to identify at least 3 strategies for improving engagement in health decisions and office visits with your clients or family members with disabilities, and you'll be able to use tools to prepare for a doctor's visit and use a checklist for follow-up after visits. In 2013, the Alaska Statewide Needs Assessment identified that family practice and primary care providers wanted more training and were least comfortable with patients with IDD compared to other disability types. The Alaska LEND created a 12-minute training for providers related to communication. This clip comes from that video and shows self-advocates describing what is important to them.
What is important to you about in working with a doctor?
That I do what they say.
I want to make my own decisions. I want to be informed about healthy decisions, but I want to be able to advocate for myself and for what I need.
Yeah, what makes it hard to understand?
It's just mostly the words and everything. Like if they're in the college, then everything, it's pretty hard to understand them if they're in the medical terms. They really want to understand is that they got to talk to us, probably I would say more slow.
So that's why it's important for them to ask our patient, like, hey, do you need help understanding why you're here? Do you need help understanding why you need to get the test done? People can ask if we do.
One thing a doctor should do when working with people with intellectual or developmental disabilities is don't assume someone's stupid. Always give them the opportunity and don't look down on them and see the best in them.
The Alaska Needs Assessment gathered information on the healthcare system and access to healthcare services for people with disabilities in Alaska. It included a literature review, healthcare provider survey, agency and support staff survey, and focus groups with individuals with disabilities and family members. One focus of the assessment looked at health disparities. A disparity is when one group of people has less of something compared to another group. In Alaska, people with disabilities have poorer health outcomes compared to people without disabilities in these key areas. They have a higher body mass index overall, increased cigarette use, less physical activity, fewer preventive screenings, poorer mental health, more diabetes, and lower rates of using healthcare. So why is this? The main reasons that we see for these disparities has to do with communication differences or insensitivity, which could be due to lack of provider training or familiarity, the overall comfort level of healthcare providers. In Alaska, many healthcare providers ranked people with intellectual and developmental disabilities as the group they were least comfortable working with when compared to other disability types. A lot of times providers focus on the disability of the person rather than the whole person, and that's one reason that regular preventive screenings are often missed. People with disabilities may need more help accessing person-centered and coordinated services. Some additional reasons would be financial barriers to care, so maybe there aren't providers in your area that accept Medicaid. Or it could be a structural barrier to care, like maybe the community that you're in doesn't have a mammogram machine that allows pictures to be taken in a seated position. So if you're in a wheelchair, it's really hard to get a mammogram. Or it could be the availability of providers. This could literally be like you're in a rural place in Alaska and there simply aren't providers of the type that you need in your community. Or it could be that you're in Anchorage and there are providers available, but they're not willing to see an adult with an intellectual or developmental disability. What's exciting about looking at these reasons for the disparities is that the top 4 that are in blue are really areas that caregivers and direct service providers have strong influence over and can really make a big difference in the health outcomes of people with developmental disabilities. In the needs assessment, these are the main ways support staff help their clients with healthcare-related issues. They arrange transportation, they asked for accommodation, they scheduled appointments, they scheduled preventive services, and they attended healthcare appointments with those they supported. Do you do any of these things with the individuals or family members that you care for? In the needs assessment, we explored caregiver roles in healthcare appointments and found that support staff who always attend healthcare visits report longer appointment times and increased provider comfort with people with disabilities. A person with a disability is more likely to access preventative health services if their support staff always attends with them, and people with disabilities whose support staff never attend their healthcare appointments experience more difficulty accessing transportation and navigating the system. Based on the Alaska Needs Assessment, the following recommendations were made. It's important that we include people with disabilities in all decisions, and that we get their feedback, that we encourage family participation, that we improve health literacy awareness of providers and request easy-to-understand information, that we help with navigating the healthcare system, and that we increase the use of preventative care, screening and diagnostic services, and therapeutic and specialist services. Now I'm going to talk about how you can support participation in health decisions at every step of a medical office visit. There are opportunities before the appointment, when you schedule it, and also when you're preparing and practicing with the individual about communication about the visit. During the visit, you have opportunities just arriving at the doctor's office and knowing the expectations for what's going to happen, navigating the office and clinic environment, visiting with the health provider, and making sure that the results and recommendations are understandable to you and the individual that you're with. And then after the appointment, it's important to know that you'll be able to follow through. When scheduling an appointment, it's important to have a clear purpose for the visit in mind and to communicate that to the scheduler in the office. Think about what time of day is best for your client. Is your client calmer in the morning or maybe in the afternoon after they've had a nap? When are they best able to tolerate things that can be uncomfortable for them? And let the scheduler know that. If your client's going to need extra time during the visit, find a time in the day that's going to allow for that for the provider. The scheduler can really help build in a little bit more time, and that can make a huge difference. Think about things like if the client can access the building, and how will they get there? Will they take a bus, or will someone give them a ride? Who will be with the client? Ask the scheduler what the client needs to bring. Maybe a medication list, ID, proof of insurance. And what are other considerations that might be needed, like mobility or equipment needs? Think of a time you helped schedule an appointment for a client or family member with special needs. What did you advocate for to help your client or family member have a good visit? Is there anything you wish you had done differently? Please pause the training and answer this question. Another way to prepare is to talk about who they may meet at the doctor's office. So when they first walk in, they may be met by a receptionist, and what is the right thing to do or say with the receptionist? And then there may be a nurse. The doctor's going to talk to them. What is the doctor going to talk about? What other people might be in the room, like other patients? Talking about this and thinking about it can help build the expectation. Also, practicing the kinds of questions that nurses and doctors and receptionists will ask so the client can answer for themselves in the visit can be a really good way to include the client. In the My Health Toolkit, under Getting Ready to Go to the Doctor, is a really fun tool for generating questions that you can practice together. You can practice sharing the reason for the visit and write down questions that the client wants to ask. You can use the handout Today's Healthcare Visit to do this. There's a link to it at the end of this training, and it's also included at the same place that you access the link to this training. Make sure the client has a list of their current medications to share with the provider, and make sure that they have their insurance information and photo ID. A common way a healthcare provider may ask about pain is to use a pain scale. This can be a difficult concept for a person with an intellectual or developmental disability. Using a scale with pictures and practicing with a scale can prepare them to communicate about what they are experiencing. You can take a copy of this scale with you for the individual to refer to. Please pause the training and practice how you would explain a pain scale to a client who experiences a mild to moderate intellectual disability. You can also see the handout talking about pain for more ideas about how to do this. As you practice with your client, use the tell, show, do model, where you tell them the idea, then show them the idea, then practice with them. This is an important way that helps all people learn. Think about what's going to be happening at the office visit. Will they be having a physical exam and need to wear a gown? If so, talk about that, and if needed, practice wearing one at home to get more comfortable with the gown. Talk about equipment that's going to be used in the visit. Maybe a blood pressure cuff, a thermometer, an otoscope to check their ears. Sometimes looking at these pieces of equipment can look scary until you understand what they're used for. Knowing what to expect can really help. Think of a time that you helped prepare a client or family member for a doctor's appointment. What strategies did you use? What worked well? Is there something that you would now do differently? Please pause the training and answer these reflection questions. During the visit with the healthcare provider, it's important to make sure the client and the support person understand the answers to these 3 questions. What is my main problem? What do I need to do? And why is it important for me to do this? Request the answers to these 3 questions be given in writing, in plain language writing. Ask questions if the instructions are unclear, and ask providers to restate or demonstrate important concepts if the client doesn't seem to understand. After the appointment, it's important to know how follow-through about the instructions will happen. If there are any changes in medication or other follow-up needs, make sure that everyone knows what to do. This includes family, other staff, and the client. Make sure the summary or follow-up information is put in your client's file and a copy goes to each person who needs it. Talk with the client about the appointment. How did they feel about it? Do they have questions? There's a checklist for supporting medical appointments which is included in this training's resources. Think of a time you supported a client or family member in following a doctor's recommendations after a visit. What worked? What challenges came up? Please pause the training and reflect on these questions. Did we achieve our learning objectives? Hopefully, you are now able to identify at least 3 strategies for improving engagement in health decisions and office visits with your clients or family members with disabilities, and you feel like you have tools to prepare for a doctor's visit and a checklist for follow-up after visits. Here are the references that we use to inform this training. Please contact us if you have additional questions.